that. You know, many of you get real critical defects. The doctors were given prostaglandins to keep that little artery open before it closed, the normal process that it closes in the first few days of life. Some blood still goes to the lungs, comes back to the veins. There's a left atrium, left ventricle, and left aorta, just like normal. Okay, so the two big things are the two shortcuts here, that atrial connection at the top, and then that PDA there. That becomes important when we're talking about different defects. Got that? All right. All right, so let's move on. We'll start simple towards our different defects. So let's follow the blood. All right, so in this child, we've got blood coming from the superior, inferior, blue blood going right atrium, right ventricle, to lungs, gets oxygen, left atrium, left ventricle, aorta, all looks good, right? And until we get to the aorta, it's kind of kinks down there, like someone kind of pinching it down. All right, shout it out if you know the answer. All right, coarctation. Good. It's coarctation. And coarctation can take many different forms, depending on the severity of how bad it is. Some kids, it comes out really small. They're going to be struggling in the beginning, just from the first day of life, hard time breathing. They're not going to tolerate their feeds. They're going to have some issues. They're not going to have good pulses in their legs. Other kids, if it's a little smaller, it's a little bit harder to pick up. It can be hard to diagnose, and it takes an astute clinician to try to figure it out eventually. Some kids, unfortunately, if it's not picked up, heart going bad, heart failure and shock. All right, so move on to the next one. Y'all did great without it. All right, so we've got, again, blue blood, superior, inferior, coming to the right ventricle, going up on this little hole here. All right, we'll remember that hole as we go out. Go out to the lungs. We've got our PDA that's still open. Come back to the lungs, go left atrium, left ventricle, left aorta, and then, doesn't get from the top part of the aorta to the next part of the aorta. This is kind of the most severe form of coarctation. You can think of it that way. Does anyone know what this is? It's an interruption here. So if you ever met anyone with an interrupted aortic arch, that is what an interrupted aortic arch is. So it's kind of like a coarctation. It's just the most severe form. There is no communication. The arch is going up and didn't develop enough to connect down to the bottom. I want to introduce a concept here that I like to think of called no flow, no growth. Blood to a developing baby is basically like fertilizer for a plant. So for any of your children, if you have a child who has this little small structure or narrow structure that didn't grow right, it's usually kind of related to the amount of blood flow that was going through that structure in utero. So in this child, for instance, this BSD is P. This BSD is kind of impinging on the aorta. So from the left ventricle, there wasn't a whole lot of flow going out the aorta. So there wasn't a whole lot of blood going to the aorta and the arch down there. So it didn't really form properly. It didn't grow as well. Okay? No flow, no growth. That's a key concept in congenital cardiology. All right, next one. All right, we've got superior vena cava here. Inferior, got blood coming through. Blood's normally going from this side of the atrium, left atrium side. We've got a lot coming across here to the right ventricle. All right, blood goes to the right ventricle. There's a lot of mixing here, you'll see. Going out the artery, to the lungs, comes back, left atrium. Really tiny left ventricle. This is that no flow, no growth principle I just mentioned. Really tiny kind of aorta here. And fortunately in this child, that patent ductus arteriosus is wide open. All right, hopefully they're on prostaglandins here. So, anyone know what this disease is, this defect? HLHS in here. Hypoplastic left heart syndrome. Hypoplastic meaning small structure, basically. It's a very small left side of the heart. And this is, thought to be, again, related to flow on this left side. You can have problems with the aortic valve, you can have problems with the mitral valve. Any of them are too small, narrowed, or even, we use this term atretic. It means kind of it sealed off almost. It's an easy way to think of it. You're not getting good blood flow there. The left ventricle doesn't grow well, the aorta doesn't grow well, and you're really dependent on making sure there's good flow going out to this right ventricle to supply enough blood flow to both the body and the lungs. All right. Similarly, though, superior ventricle, blood coming down, IVC blood coming up, tries to go, whoop. There's a little closed tricuspid valve there. Blood can't go there. Has to go across the atrium. Blood coming back to the lungs, left ventricle, And then from the left ventricle, blood can go either out to the rest of the body or through this opening, hopefully a VSD, out to the lungs. Anyone know what this one is? Shout it out if you know it. Tricuspid atresia, right. So it's very similar to hypoglossal heart syndrome. You can think of it as hypoglossal right heart syndrome, but we call it tricuspid atresia because we know that it's typically formed by the tricuspid valve being completely obstructed. Okay? Same principles apply. You need to make sure there's good flow going through the lungs and the aorta. We're going to talk about that when we get to surgery. Another single ventricle group. Blood from an SVC, IVC, goes down to the right ventricle, goes, whoa, that's kind of sealed off there. Can't go out to the pulmonary artery. All right, so blood's going to go across that opening in the atrium again. Here. So the pulmonary valve here is atretic. This one, shout it out. Almost atrology. We're talking atrology a little bit. But this is pulmonary atresia. And we make a distinction here, intact ventricular septum. That just means because there's no hole between the two ventricles. It doesn't